Okay, well, welcome everybody. And I am very hopeful that you had a chance to look over the recording from last week if you didn't get a chance to do that already. But we are going to do a very, very brief overview of the framework that we went over last week. So even if you haven't gotten a chance, there's a good way to catch up, right? The whole purpose of today is practicing what we learned about how to create teach back prompts. And not just practicing, but actually just taking the time, taking this hour as a sort of like dedicated time for you to sit and just create prompts that you can use in your day to day. Okay. So this is the agenda that I'm proposing for today. It seems like we have a lot of time, but we don't. I'm just going to go through the learning goals very quickly and then have that refresher of the anatomy of a best practice teach back prompt. And the main chunk of what we're doing is the share outs of the scenarios, right? I'd like us to share out in the big group before we go into the small group, because then that gives everyone a sense of what feedback to provide or what may help when you have shared your personalized teach back prompts with them. And then we'll come back together and do a few reflections. I hope we have time to do that. Okay. So most of you are off screen. So I'm just going to assume that you are nodding vigorously in agreement. But if you have any questions, any thoughts, please do come on, unmute yourself and say something. We're trying to recreate that room that we had back at IHS headquarters here, right? And the Zoom is going to only do so much if we can't see or hear from each other, right? So let's move on. Okay. So today's goals, and remember, this is a follow-up of the Teach Back training that we did last week. So if you hadn't had a chance to review it, you may be a little bit lost, but hopefully not too much, right? We are going to build the Teach Back prompts based on what you share as your situations where you believe that Teach Back may be helpful. And then we're going to also just get feedback from your peers to make these phrases together. If you will recall from last week, teach back doesn't necessarily come naturally, and it requires practice and actually being thoughtful, because it's also possible to have the good intention, but also use some words and phrasing that either judges or just makes the situation feel like someone is being singled out. So we are building this bank of phrases that you can use for your own day-to-day. Quick refresher. If you are on and you have been able to figure out how to use Zoom, can you show up either by raising your hand in Zoom or just putting in the chat whether you were able to attend last week or review the material, because that will let me know just how much depth I should go into at this point. Right. So sometimes if you're not familiar with the platform, raising your hand is a little bit hard. So just put in the chat. Okay. Okay, I see. Okay, great. I know Megan wasn't there, but Megan has reviewed. All right. So we are not going to spend too much time on this, but I'm asking you to recall from last week so that you can actually do the exercise somewhat with this framework in mind, right? I shared this deck ahead of time, so you also have it. Hopefully you can open it on another screen and look at the framework when it comes to the time for using it. But let's talk through this, that 5 key elements of effective teach back prompt. The first thing is acknowledging the difficulty of the information that you are sharing. And this builds trust, right? You are starting out with kindness and an acknowledgement. You know, in any situation, it is helpful when you feel connected to the person in some way. And in this, by acknowledging the difficulty, you are sharing that, yes, this is my job, but even I know that this can be difficult. The second element is then normalizing, saying, I do this for everybody. This is the way that we work. We're not singling you out for any reason. We're not making any assumptions. The third then component, after you've acknowledged the difficulty, you've normalized, is sharing responsibility for clear communication. Making it clear that it is a two-way path to make sure that what you are sharing is understood. So saying, we tried various phrases last week, saying things like, I want to make sure that I have explained it in a way that you understand. I want to make sure that I have done my job, essentially. The fourth element is breaking up information into smaller parts. So not say share everything that we've talked about, right? Breaking it up, doing part by part. And then even when you've done it part by part, making specific focus requests. So if it was a medication conversation, for instance, how will you take your morning medication at home? So far so good. Again, I don't see you, but I hope that you recall this framework. And if you look in the deck, I'm just pointing this out to you. If you look on the deck, keep scrolling past it. There is a scorecard that you can use as you are working through making your phrases. Remember, this time is really yours to just bang out a couple of phrases and prompts that you can use in your day-to-day. All right. So this is the time where now you are not able to be on mute. You're not able to not be on camera for this. Well, at least you're not being on mute for this. We had talked about it at the last meeting, and also I had shared via email that please come with some situations, real world situations that you can work on in this time, and then also get peer feedback on. So it's a virtual room, but I have everyone listed. I have two screens, sorry, that's why I keep looking off to the side. I have two screens where I can see everyone here. So we're going to do a virtual round robin, and I'll ask each of you to speak for a minute or two, right? We want to leave at least half an hour for doing the group work, and share 3 example scenarios. Now, if you didn't come up with 3, that is okay, but I trust that there'll be some scenarios. And again, if you look in the deck, I shared some example scenarios to help jog your memory if something was not coming off the top of your mind. You know, when you are doing work and you've been in it, it seems like it's just Tuesday, it's just normal. But when you think about it, you are actually doing various of these scenarios that I listed on the previous page, okay? So we are going to have each person talk, describe the scenario. That means describe the key people. So you can start, this is the scenario, this is usually who is in the conversation, this is what I'm usually trying to share with them, okay? So it's not, oh, let's see, we just have someone joining. Hopefully you had a chance to do that ahead of time. If you didn't, it's not a test, it's not tasking. You just want to share out and get a sense of the scenarios within this group, okay? So I am going to call out folks in the way that they are listed on my screen over here. And Dr. Althea, you are the first coming up because you are graciously sharing your video. So please, and I can imagine that you have a lot of these scenarios. Please do share up to 3 example scenarios that you would like to work on today. You are on mute at this point, yes.
Sure. So yeah, so I actually successfully used Teachback this week and it worked really well. So the scenario was, so I was seeing a patient who has recurrent infections with this bacteria called MRSA, which have been really problematic. And so she was referred to me as an infectious disease specialist to try to see what we could do to reduce how often these infections happen. And so we talked about different options, and we were going to try this regimen that's pretty intensive. It requires the patient to use a body wash, a mouthwash, and an ointment that goes in the nose. Um, 5 days out of the week, twice per month, and some of them are once a day and some of them are twice a day. So it's pretty complicated. It's multiple things, a very unusual timing regimen, and then so it's pretty complicated. So we were kind of going over this and looking at a calendar and looking at what day she would do it and what day she would not do it. And so then I was like, oh, this would be great for Teach Back because I really can't tell like this is very complicated, and I want to make sure that I'm communicating clearly. So I used like one of the prompts, how it was sort of like we do this with all of our patients because I want to make sure that like I communicated clearly enough. And she was very receptive to that. And I was like, can you, teach back to me like how you're gonna take these? And she did it perfectly, and it was really good. And like she was there with a relative, and she and the relative were smiling, and it was like it felt like a very positive interaction. Like it was received well, it went well, and it made me feel a lot more confident that I had explained clearly enough how to do this kind of complex regimen.
That is that is so gratifying to hear. I'm so excited about that. And I'm so glad that you had that sentence in your back pocket, right? So last week we had sentences pretty much that came from me. The goal today is to personalize those sentences that make sure to make sure that they sound like you, right? So thank you very much for sharing that, Dr. Alithia. Um, Dr. Paula, you are next on my screen.
Yes, thank you, doctor. I don't work I don't work in direct care, but
Mhm.
as you're sharing, I'm thinking of the other day, my daughter who has sinus issues. Um, so I was showing her how to use um, one of the Medi bottles to clean her sinuses out, and she didn't want to try it because she said, nah, it's too, difficult. Um, so, I walked her through using the bottle to flush out her sinuses, and she realized it wasn't quite as difficult and as um, unpleasant as she had originally thought. So I started with, preparing, teaching her to prepare the Medi bottle with the saline solution, and the position she would have to take to rinse her sinuses out. So we went step by step. I reassured her, I know this isn't the easiest thing to do, but you'll feel better. And once you practice, it'll be second nature. So that would have been my teach back experience for the week.
I mean, that is actually that really illustrates that teach back. It doesn't even only happen in clinical situations at all. So there were some community situations that I put here, but also outside of healthcare, right? There are many things that teach back is actually quite useful for. Thank you so much
Right.
for sharing that,
Yeah,
Dr.
no
Paula.
problem, doctor. Thank
Okay.
you.
All right, Alberta, you are next on the screen. There are health promotion scenarios, clinical scenarios. If you hadn't had a chance to think about them prior, then you can look at.
Oh, I'll go ahead and go share. I didn't actually do the teach back, but I was my grandson got new braces, and so I the dental hygienist didn't explain to him, how to go floss or anything. So I asked her if she can be able to demonstrate to him how to floss correctly and what food not to eat, and that may break his braces, the retainers, and then also how to brush correctly and all that. So and so she did get a model and explained to him how to do it, and then she also um, uh, was able to use the model as well, and then also how to get around the braces in order to, how to floss correctly. So he actually tried to floss his own teeth with the new braces on. So and then also to be able to talk about what type of food to avoid, and so he had many questions for her of what type of food to avoid, because when he hears it from me, he doesn't believe me. I thought it'd be great for the dental hygienist to explain it to him and tell him what food to avoid, so he can go directly hear from somebody other than myself. So
Right.
that really helped him, and then I think it really helped him
to when you did the demonstration, and then actually to do the demonstration himself, and then with a prompt from me as his grandma to make sure that he follows the how to take care of his new braces.
Thank you for sharing. That is like you've moved on to the P, the pictures and multimodal, but that's all part of the components that we've learned are important here. So let me take, actually, Gary, you are showing next on the screen here. I also want to point to you all who are on here now that in the deck that I shared, there are some example scenarios that maybe you will find that you have been having some conversations like that, right? Because this part of the exercise is also to help us identify what you will work on in the small group. So if nothing is, if you weren't able to come with something already identified, please do take a look at the 2 pages around the clinical scenarios or the community health promotion scenarios, so that you will have something to work on when we break into the small groups, okay? Gary, you are next on the screen here. And you're sharing some scenarios where you believe Teach Back can be applied.
I'm just teasing. No, last week we have a diabetes clinic that happens once a month, and so we had similar to Alberta's situation, is that, you know, when your parent can tell you something, but then when it's from somebody else from a different perspective and maybe in a cultural sense, the importance of using your body, because we were doing some physical activity and they called me in and they said, hey, can you help me out, help us out, because this kid was highly resistant. He was already, you know, diabetic. And so they're trying to get him to do some physical activity. So and they were all females in there. So having another male and asking him some questions and seeing if he understood was which he did. I checked his understanding of it, and then I've kind of rephrased it in a cultural sense, and then I think he was way more receptive when we kind of funneled it through a cultural lens of what the importance of physical activity is, and so he was I think he started kind of having a little bit more fun after that. So that was my direct patient interaction with one example of Teach Back, and where hearing something from one side can change when it's maybe funneled through a different lens or a different perspective. And then also we have our IPHW summer program that's starting too. And so Monday we had so many people coming in with their applications, and so turning in those applications and walking through just instructions with them and gauging what they understand, and having them show me the different areas that they might not have understood, and what they understood from that was also valuable in just guiding and giving instruction, hearing back what they understood. And some of them was way off, but at least I checked their understanding before I send them off to finish their apps. But you need 3, or is it just
no, that's that. I mean, those 2 are fine. I'm thinking about what you could work on, for instance, to get some more sentences and phrases in your pocket for doing that checking of the understanding, right? Because that's the Teach Back, and having something that's personalized to how Gary talks using the guidelines would be something that you could use a time for.
Yeah, I said just go ahead and explain to me what you understand. I mean, what from the beginning, what we talked about. So that was the things that I used.
Okay. So when we go into the small groups, and Gary, I can pick on you because you have such a great spirit and you're so fun. One of the feedback that I would hope your team members will point out to you was that go ahead and explain to me everything we've talked about isn't quite breaking up the information, right? But this is the exact purpose of doing these exercises, because in the moment, it is so easy to have some of those pitfalls, right? The sentences that really sort of take you away from the effectiveness of the Teach Back. It is definitely better than not doing that, but a best practice would be to ask them to talk about particular times, right? So Gary, that could be your exercise in the small group, just that conversation. How could you have broken out the information? Right? Okay. And thank you very much for sharing that with us. Dr. Nathan, you are next on the screen. In a scenario, let me go back to the screen with the exercise. A scenario in your daily work where the lead teach back can be applied.
Yeah, and for that, I would say one of the most common teach back opportunities that I've had recently has to do with patients that need complete denture. So that means that we just recently extracted all of their teeth, and you can imagine it can be difficult to eat at that time and figuring out what foods are available. And so our clinic recently created a handout for the patients in conjunction with the registered dietitian. And so it really helps out with that conversation with the patient and using that teach back to go over different types of foods that work out well, and then normalizing the whole situation that you're not alone and that we are doing everything we can to get you into appointments for dentures. And then as far as asking for their feedback and breaking it into smaller pieces, coming up with foods maybe that they can think of that they are familiar with, that are less processed, but more whole foods that would work well for them, and how they could prepare those and so on. So again, bite-sized pieces without the pun there, but yeah, that's
Okay.
Yeah.
Yes.
Okay.
Thank you very much. And that sounds like an excellent scenario for you to just like use. Now we are getting short on time, but use a couple of minutes to think through what questions can I or prompts can I use to make sure I'm checking these boxes. Right?
Yes. Yeah,
with the group feedback. Okay, so we are actually getting to the time that I had planned us to spend no more than 30 minutes on this, and I see we have a couple more folks to share. So I will ask Taryn. Taryn, can you please come and share? Not this one. Sorry. Describe a scenario in which you believe teach back can be applied. And then this could be something that you're working in the small group.
Okay. Hi, can you hear me?
Yes, we can hear you.
Okay, perfect. Hi, everyone. So same as Paula, I don't really have any direct connection, with patients and all, but I'll give an example of a meeting that I had this morning, just going over some COVID funds, budget funds, and trying to explain things with a colleague on how that works. And I think being able to pull in a spreadsheet, a picture, using that graph and explaining that helped a lot, and just going over each of, the items that needed to be cleared up and stuff. It helped a lot, providing an initial background of overview of how the funding came about, and then, asking her if, just getting feedback from her and asking her if she understood where X, Y, and Z came from and that sort of thing. So it was a pretty productive meeting. It made things flow a lot quicker, and definitely using the spreadsheet tool is very helpful.
Yeah, and for your world, this is a real world situation. So we can definitely give you feedback on the prompts that you make around that situation, whether it's checking these boxes. So we have 4 more people, and then we can get into the small group breakout. Adeline, you are next on the screen. Yep, I think it's Adeline.
Okay. Good morning, everybody. I think my teach back goes back to during the pandemic. At that time, I worked in a behavioral health clinic, and every now and then we would get frantic calls from patients or community members who were extremely stressed out. I felt like they were having anxiety attacks, and they would call us asking what they could do and sometimes recommending or suggesting that they come into the ER was not something they wanted to do because, they felt like that put them in more harm than staying at home and trying to address their anxiety. So what I learned how to do was to teach breathing exercises, breathing or inhaling deeply, holding it, and then letting it out, and just going over this exercise a couple of times with the patient until they calm down. And then telling them that, if they felt anxious again, didn't want to come in, these exercises would help. And I'd usually stay on the phone with them for about maybe 10 to 15 minutes, also talking to them about their anxiety and, how they felt as they moved along during the exercise and whether or not the guidance helped them.
Thank you very much. That sounds like an intense situation. Is that something that you anticipate having to do more of? Would this be the scenario that you do your exercise on? Or was that
I think so.
Okay, all right. So if when you are doing your exercise, maybe use that scenario and then you have your team members comment on whether you are essentially checking the boxes on the prompts that you're using. Thank you for
Okay.
sharing that. Dr. Anna, you are next on my screen.
This is Anna. I'm not a doctor, a family nurse practitioner.
Okay. Thank you.
Thank you. And I apologize. I'm driving, so if there's any background noise.
No worries.
I'm really fortunate. I'm in a consultant role, and so I have lots of different opportunities to bring all of my different bags of tricks to the table. And so this week, a great example that I would love to share is that I am a certified trainer for a program called Stop Bleed. And if you're not familiar with that program, it's a program that was developed by the American College of Surgeons to address the major cause of traumatic death, which is hemorrhagic shock or bleeding out. And so in this day and age, when we have all kinds of mass casualty incidents, it's really a great opportunity to put some tools into people's hands in addition to the necessary implements. So I had a class at my new office that I returned to office with. And what we did is I took them, we used a video training platform where they completed, and then I did the in-person skills only demonstration check. And so when we came together, quite often, just like when people go to CPR classes, everybody's a little nervous to perform. And so I tend to use humor a lot to kind of de-escalate things. And then I do a check-in with everybody. I kind of went through, reviewed the major tenets of the class, one by of the virtual session that they attended and completed, and then went, section by section to check for understanding and allow for questions. And then after that, what we did is I did a demonstration myself of the skills, and then I allowed each of them an opportunity to practice, and then was able to give them feedback as they were performing their necessary skill. And then a final skill check we went through, and I would give them a scenario in which they needed to, start from beginning, to scene save, calling 911, that sort of thing. And so allowed them to go through that and acknowledged when they missed a step in a gentle way, and then provided positive feedback, through the process and at the end, and then, made sure to reinforce with the group the important things to remember in a summary type form. And so, the class went really well, and I think everybody feels better for having had it, because they're all environmental health techs that go out to construction sites quite a bit as well. And so that gives them a little bit of sense of security, knowing that if there's a medical emergency, that they're better equipped to help.
Oh, okay. And since you are driving, I would not recommend that you write the exercise down, but maybe you can think about it and share it with your group. What are some of these phrases that are not phrases, but are checking each of those elements? All right, let's push through. Thank you for sharing that, Anna. Erica, we have Erica, Teresa, Megan, and Emily, and then we will do our small groups. I think we'll have about 3 people in the group. But can you share with the full group, Erica, a scenario in which you can work on to personalize?
Hey, can you hear me okay?
Yes, we can hear you
Okay,
now.
great. Hey, good morning, everybody. So my situation is a little bit on a larger scale. So recently NAVO had a social media post that was circulating that highlighted that we had a confirmed measles case in our area. And unfortunately, it was shared with some government entities associated to the tribe. So people thought it was something that was verified and true. So the facility that was associated to the jurisdiction of this case, they took that information and flipped it to have a teaching opportunity for the community to highlight and emphasize the importance of the MMR vaccine, where folks can visit the clinic and receive that vaccine. And they also provided an overview of signs and symptoms associated to measles and when to seek care. So I think that also highlights on a larger scale the importance of using verified and trusted information, but also it was an opportunity for them to teach the community about measles and the prevention about it. Thank you.
Okay, thank you. So I think even in that scenario, if you have to talk to somebody, it might be helpful to have some prompts that make it not like you're singling their knowledge about the MMR or measles in general. So maybe that can be the one that you work on, right? What are some prompts that you use around that? Hi, Teresa, you are next on the screen. For me, actually, this is how you are arranged. Can you share?
Hello, this is Teresa. Can you hear me?
Yes.
Okay, well, I don't have a work one, but I do have a personal one. This week this Sunday, I ran a marathon, and one of my friends ran the marathon with me, and she came in a few minutes behind me. So we were at the finish line, and she was having a hard time walking and just kind of, I guess, moving, if you will. And I had the sense in me to just kind of take her by the arm and just told her to walk with me. And I read somewhere that after completing a marathon, it's important not to sit down, and that's what she wanted to do. So I walked with her. What I read was that you walk for at least 20 minutes before you sit down. And so I just kind of keep that in my mind. And I was walking with her and just showing her the steps. And, she was just kind of there. And then we did a few stretches, and she wasn't like saying what I was having her do back to me, but she was moving like I was moving, just doing a few stretches and movements. And I think that kind of helped her just kind of get her sense back about with her. And so that was kind of my thought that came to mind about the teach back. And I wanted to try it in a CEO meeting this week when I presented on public affairs updates and HPDP updates. But then we were virtual, and then did it really happen because of the timing? So I just kind of let that go. But those are my 2 little scenarios. Thank you.
Thank you. Thank you. And you can think of another scenario that may come up that even though this one didn't happen, another meeting in which you want to use teach back, and having those prompts in your back pocket make you more confident about doing it, right? So maybe that's what you can work on. All right, Megan, and then Emily.
Hi everyone, good morning. So with our public health messaging team, we're making a few flyers and posts actually for the month of May. May is Stroke Awareness Month. So there's a motto in our flyer that says act fast. And fast is a mnemonic for facial, arm, speech, and time. So with our team, I think we're trying to be responsible for making sure that we have clear communication to our audience and those who see our flyers or our posts. So I think the teach back here is that our team is trying to break up the information into smaller parts or sections, just so it's easier for folks to remember when they see our flyers or our posts.
Thank you very much for sharing that. And then Emily, last but not least, before our small group.
Hi, can you hear me?
Yes, we can hear you now.
Oh my gosh, okay. Hi, so what we worked on, one of the other things that we're working, oh, Lucinda has her hand up.
Oh, sorry, Lucinda. Yes, no, sorry, I almost missed
Don't forget
Lucinda.
me, but
Yes.
I'll wait for Emily.
Emily, yes, I'm sorry.
Okay, really
Yes,
quickly,
Emily and Lucinda.
what we worked on so far actually is the opposite. It's not like with the patient, it's actually with the providers. So we're working with maternal child health on something for kind of like a roundtable discussion, just barely the beginning of it, but providers, not to be mean about anything, but sometimes providers forget about patient experiences and things like that. So ours is more coming toward I guess the patient side, and also reminding providers that health literacy, universal precautions of it. You know, just because you give us a paper, we're not going to read it and we're not going to look at it and we're not going to understand what it means. So kind of bringing that part back to the top, you know, like the patient's experiences, rather than coming from the provider lens, look at from the patient experiences and how things could have been avoided for like maternal child health patients. So that's one thing that we're working on. We're working on.
Okay, so it's interesting. It's almost like you are using Teach Back to teach the importance of the providers doing things like Teach Back. All right, thank you very much. And trust me, if you have a few prompts in your back pockets, that's really helpful. Lucinda, sorry, you had fallen off my screen, but yes, please do share.
Thank you very much. So what I've been recently doing is working with several staff members regarding PowerPoints. And there are teaching moments, and many of these are individuals who are pharmacists, medical providers, and helping them to design PowerPoint so that patients or their audience would better understand. That has been basically what I've been working on for the last couple of months. I know that several times there would be questions about cultural, and it's always good to know when to add some information so that their readers or their people in the audience who are not MDs or PharmDs or pharmacists, don't have any of those trainings, how they're able to communicate with the individuals that are in attendance to their presentations. And then also just working on designing flyers that's easier, more like a 4th or 6th grade reading level, in promoting information regarding preventing cancer or preventing any other chronic medical conditions. Those are basically the areas that I've been working on lately. Thank you.
So thank you for sharing. So I could see you, especially when you're talking to the providers about the importance of the communication, using some teach back prompts to ask them, just to make sure that the providers understand why it is even important to do what you're asking them. So that could be the scenario that you spend your 10 to 15 minutes building out on. So we did it. We did the round robin. I was a little bit worried how it would go in a virtual room, but we did it. So I think we all have a sense of the various scenarios that everyone could work on. We're now going to go into small groups, just about 2 to 3 people per group. In the group, what you will do is for your own scenario, I most likely the one you've just spoken about, but if something else has come into mind, just take time and write as many prompts that you think will be relevant, things that you could say, right? We shared examples last week, but almost all of them were related to clinical or health promotion activities. Maybe that's not what you do. For your own area, write the prompts. And then in the small group, take that scorecard, which is on the next page and I can display it, but I'm not sure if you can see it whilst you're in the group. And then check for each of the members whether you are covering those points, right? And give feedback so that the person can revise it as needed. Think of this as protected time that you would never otherwise have to sit down and build your bank of prompts that you can pull out and use. Because if we know anything, it's that the intention alone is not enough. You need to practice it before it becomes second nature, okay? And then we'll come back to the group. We'll probably have just 2-3 minutes for some comments from what people heard in the small groups. So I'm going to assign breakout rooms now. Let's see how that it goes. And opening all the rooms. So does everyone see a room to get into? All right. So, do we have everybody back? Thank you for doing that exercise and indulging in that exercise. I have a couple of reflections. I wasn't able to visit Dr. Nathan Tarrant's room. So maybe we could start, if you guys had some reflections that you could share, and then Adeline and I wasn't able to visit your room as well. But in each of your rooms, did anything come out as you were looking at or listening to what your colleagues were saying? Were there any elements in particular that were missing or that were hard to incorporate? Right, then let me share the screen of the elements again. Any reflections from that exercise? And I do know it's kind of weird to sit down and think of sentences you will use in the future, but as we have been talking about, you have to be very purposeful about inviting people to participate and teach back and making sure that they are not feeling singled out or judged in any way. So can you see the screen right now? What do you see on screen? I'm not sure if I'm sharing. Do you see the teach back prompts?
We see the reflections.
Oh, the reflections. Okay, right. Well, yes, let's talk about that. We are in the last minute here. Anyone want to close us out with a reflection on the exercise?
I'll go. This is Taryn.
Thank you. Yes.
Real quick, I have to also jump on another call, but just real quick, one of the last pieces we talked about was like the elements are very helpful in making sure you include that, you know, with the teach back process, the prompts and such. But we thought like focusing on the colored portions of the plant, the pot, and trying to use that and relate, okay, the base is gonna, you know, be the foundation, and then looking at the flower piece and, you know, that's the teach back, and kind of breaking that down as far as trying to remember and incorporate that into the prompting portion. So that was kind of the last piece.
Well, I'm glad that someone noticed, because I was trying to do that pictures and multimodal. Some people just look at a list, some people need something more visual, some people need me saying it 5 times. So thank you very much. We are right at time, so I will wrap up. We will see each other again next month. I would very much appreciate if you took a moment to fill out the evaluation for this session. And I'll put the link in the chat again. But other than that, please, thank you. Thank you very much.